Hello everyone, nice to see you. My name is Linda. Today we will talk about an important topic related to women's confidence and beauty, breast health. As the saying goes, a woman's beauty comes from within. The breast is not only a symbol of femininity, but also a signal light of health. Many women feel very nervous when they touch a lump in their breast, fearing it might be cancer. In fact, breast lumps are very common and most are benign, but the key is to understand them, take them seriously, and deal with them scientifically. Next, let us step into the world of breast health. Sorry, wait a moment. My computer. First, we need to know that the breast changes dynamically throughout a woman's life. It begins to develop in the embryonic stage and remains dormant during infancy. In adolescence, it starts to develop under the influence of hormones. This is the most beautiful stage of the breast. During menstruation, the breast proliferates and regresses with the cycle, which may cause swelling and pain. During pregnancy, the breast expands again for lactation. In menopause and old age, the glands gradually shrink and fat increases. Therefore, at different ages, breast conditions and problems vary. We should follow these patterns to take care of our breasts. Have you heard of accessory breast? Some women raise their arms and find two lumps of flesh under their armpits. They think it is fat, but it might be an accessory breast. This goes back to embryonic development. We originally had several pairs of mammary buds, but most regressed, leaving only one pair on the chest. If the pair under the armpit doesn't regress completely, an accessory breast forms after birth. It can occur in both men and women, but is more common in women. Accessory breasts can also undergo hyperplasia and even develop lumps. So, don't forget to check this hidden corner under the armpit during self-examination. During clinical breast examination, we divide the breast into several areas: upper inner, lower inner, upper outer, lower outer, central area, and axillary tail. Why emphasize these divisions? Because 60% of breast cancers occur in the upper outer quadrant. Looking at the structure, the breast is like a bunch of grapes, composed of 15 to 20 lobes, and is influenced by hormones. The ligaments and the fascia that fix the breast are not affected by hormones. When cancer cells invade these ligaments, they pull the skin inward, creating a dimple. When they block lymph vessels, the skin becomes like an orange peel. This is the orange of the dimple sign and pod range appearance. What breast cancer feels most is metastasis. Look at this picture. The lymphatics around the breast are like a network. Cancer cells first go to the axillary lymph nodes, then may spread to the interpectoral and supraclavicular areas. Pay special attention to the supraclavicular lymph nodes. If cancer cells reach here, it means they have likely entered the bloodstream and spread throughout the body, which is an advanced stage. That is why we emphasize early detection and early treatment. During self-examination, not only should you feel the breast, but also check the armpit and supraclavicular or infraclavicular areas for any swollen lymph nodes. What causes breast lumps? First is endocrinology. Estrogen and progesterone act like an accelerator and brake. When they are disrupted, lumps easily form. Second is genetics. For example, celebrity Angelina Jolie had a preventive mastectomy due to a genetic mutation. Third is congenital development. For example, inverted nipples can easily lead to milk-stasis and cyst formation. Abnormal development of accessory breasts can also cause cysts. Additionally, breast augmentation with implants or injectable materials may cause surrounding tissue hyperplasia or inflammation. Understanding the causes allows us to take targeted preventive measures. There are many types of breast lumps. Among benign tumors, the most common is fibroadenoma, which is smooth and slippery like marble, mostly seen in young women with an extremely low malignant transformation rate. There are also lipomas and hematomas, which are basically harmless. Non-tumorous lesions include breast hyperplasia, which is related to the menstrual cycle, causes swelling and pain, and has unclear borders. Ductal origin lesions include intraductal papilloma, with a typical manifestation of bloody nipple discharge and the cancer risk of about 6 to 8%, which requires vigilance. There are also inflammatory masses, which often occur in lactating women. In summary, the vast majority are benign, but we need to distinguish the types. How to self-examine at home? Remember, look and feel. The best time is 7 to 10 days after menstruation. Look. Face the mirror with hands on hips and wrists. Observe whether the breasts are symmetrical, whether there is skin dimpling or port range change, and whether the nipple is inverted. Feel. Lie flat and use finger pads to press in small circles, starting from the upper outer quadrant, covering the entire breast, armpit, and supraclavicular and infraclavicular areas. Finally, gently squeeze the nipple to see if there is any discharge. Note: self-examination can't replace professional screening. If you find any abnormality, See a doctor promptly. Lumps in different locations have different probabilities. Breast hyperplasia is often patchy or mass-like, feeling like a clump. Breast cancer occurs in the upper outer quadrant in 60% of cases. It's irregular in shape, uneven, and easily adheres to the skin. Fibroadenoma is mostly in the upper outer or lower outer quadrant, with a clear border, like a small ball. Breast adenoma also favors the upper outer quadrant. Most benign tumors are round and smooth, while malignant tumors are irregular. Special reminder: if a man over 40 finds a single breast lump, he should also take it very seriously. Men can also get breast cancer. Okay, who is more likely to get breast cancer? Hormone related. Early menstruation before age 12. Late menopause after age 50. Never having given birth or breastfed. Long-term use of contraceptives or estrogen. Genetics related. Genetic mutations or family history. Lifestyle. Obesity, high-fat diet, high stress, exposure to environmental hormones like BPA. Age. Risk increases significantly after age 40. Therefore, high-risk groups should perform self-examinations and screenings more frequently. Of course, having these risk factors doesn't mean you will definitely get cancer, but it reminds you to pay more attention to your breast health. How does traditional Chinese medicine maintain breast health? The core is 8 characters: soothe the liver and regulate qi, resolve stasis and relieve pain. Women who are emotionally unstable or prone to anger are most likely to develop liver qi stagnation. And when qi is blocked in the breast, lumps form. So first, maintain a cheerful mood and get less angry. Second, avoid obesity that produces extra estrogen. Third, wear comfortable underwear and don't bind too tightly. Fourth, maintain a regular lifestyle. A harmonious sex life helps regulate endocrine disorders. Fifth, keep bowel movements smooth. TCM believes that long-term constipation causes qi stagnation, which aggravates breast tenderness. So, promoting bowel movements also promotes breast health. Next, let me introduce several Greenbold products that nurture breast health. First is breast care capsule. It has 3 effects. Herbal leonuride invigorates blood and resolves stasis, touching blood stasis type lumps. Semencoices and rhizomas myelasis glabre drain dampness and transform phlegm, touching phlegm dampness type lumps. Fructus hodii germinatus soothes the liver and regulates qi, reducing lumps caused by qi stagnation. Together, they disperse, soften, and move qi. Then there is breast care tea with rhizoma cyperi as a core ingredient, most effective for lumps caused by emotional stress and pressure. Plus rhizoma, Chuanxiong, and radix angelici sinensis to invigorate blood. Porphyr and Stemon causes to drain dampness. Gardenia jasminoides and Rehmannia glutinosa to clear heat and reduce swelling. Note, not suitable for pregnant or breastfeeding women or children under 12. Greenwood soy power capsule has soy isoflavones as its core ingredient, known as plant estrogen. Its beauty lies in bidirectional regulations. When estrogen levels are too high, isoflavones occupy receptors to prevent excessive estrogen stimulation. When estrogen is insufficient, they act as a substitute to relieve menopausal symptoms. It also contains Ganoderma lucidum spore, which enhances immunity and regulates anti-tumor ability, and Baizhi, which clears heat, removes toxins, reduces swelling, and expels pus. It's suitable for menopausal women and those with estrogen disorders. Similarly, not suitable for pregnant or breastfeeding women or children under 12. Greenwood pine pollen tea has pine pollen and green tea as its main ingredients. Pine pollen is known as a natural micronutrient library, containing over 200 nutrients, and helps maintain metabolic stability. Green tea is rich in tea polyphenols, which are core components for antioxidation and anti-tumor effects. Together, they provide comprehensive nutrition on one hand and eliminate free radicals to reduce cell damage on the other. For breast health, strong antioxidant capacity means a lower risk of DNA mutations and a reduced chance of tumor formation. Drinking it daily promotes health and prevents disease. Who is especially recommended to take this nutritional regimen? First, women with breast hyperplasia or benign tumors to help control lumps. Second, menopausal women to balance hormonal fluctuations. Third, those with menstrual irregularities accompanied by breast tenderness. Fourth, long-term oral contraceptive users, because contraceptives affect hormones. Fifth, postmenopausal obese women. Fat converts to estrogen. Sixth, those with long-term high estrogen exposure, such as from certain cosmetics or supplements. Of course, it is recommended to consult a professional before taking and choose according to individual circumstances. Alright, next, breast cancer. Breast cancer is a type of cancer that originates in the cells of the breast, usually in the milk ducts, ductal carcinoma, or the milk-producing glands, lobular carcinoma. The adipose cells in breasts are rarely found to be cancerous, so those with plumpy breasts are not with higher risk of getting breast cancer. Breast cancer is one of the most common cancers worldwide, affecting both women and, though less frequently, men. Globally, men diagnosed with cancer outnumbers women diagnosed with cancer, primarily due to a large number of men smoke and drink alcohol. That is especially true after 55 years old. But during 30 to 55, women with cancer outnumbers men. Why is that? The reason lies in more women having breast cancer. As a matter of fact, breast cancer is the number one among other cancers found in young people, accounting for 20% in cancer patients below 40. Every year, 200,000 young women are diagnosed with breast cancer. Breast cancer 5-year survival rate is relatively high compared with other types of cancers. In Europe and America, it's 90%, and in China, it's 83%, while in West Africa, it's only 52%. Early detection, diagnosis, and treatment is the key. Breast cancer isn't just one single disease. It has several types, and they are usually classified by where they start, whether they have spread, and what makes them grow. The most common type is invasive ductal carcinoma, IDC, which begins in the milk ducts, the tiny tubes that carry milk to the nipple, and then breaks out into nearby breast tissue. Another common type is invasive lobular carcinoma, ILC, which starts in the milk-producing glands called lobules and can also spread beyond them. There are also non-invasive or in situ types, such as ductal carcinoma in situ, DCIS, which means abnormal cells are found only in the lining of the milk duct and haven't spread further. This is considered the earliest form of breast cancer. A less common but all the more aggressive type is inflammatory breast cancer, which doesn't usually form a lump but makes the breast look red, swollen, and warm, almost like an infection. Another rare and aggressive type is triple-negative breast cancer, which lacks 3 common receptors: estrogen, progesterone, and human epidermal growth factor receptor 2 that fuel most breast cancers, making it harder to treat with hormone therapies, but often responsive to chemotherapy. On the other end, HER2 positive breast cancer has too much of a protein called HER2 that helps cancer cells grow quickly, though there are effective targeted treatments for it. There is also hormone receptor positive breast cancer, which grows in response to hormones like estrogen or progesterone. This is the most common type and often treated with hormone-blocking medications. In short, knowing the exact type of breast cancer helps doctors decide on the best treatment and gives a clearer idea of what to expect. Breast cancer risk factors are things that can increase your chances of developing the disease. But having one or even several risk factors doesn't mean you will definitely get breast cancer. It just means your risk is higher than average. Some risk factors, like being a woman and getting older, are unavoidable. Breast cancer is much more common in women than men, and the risk goes up as you age, especially after 50. Genetics also play a role. If you inherit certain gene mutations, like breast cancer gene 1 or breast cancer gene 2, or if you have close family members, mother, sister, daughter, who had breast cancer, your risk increases. Other factors relate to lifestyle and hormones. Starting your period early, before age 12, or going through menopause late after 55, having your first child later in life, or never giving birth. Not breastfeeding, using combined hormone therapy after menopause, drinking alcohol regularly, being overweight or obese after menopause, and not getting enough physical activity can all raise your risk. It's important to remember that many people with risk factors never get breast cancer, and some with no known risk factors do. So regular checkups and healthy habits matter for everyone. Breast cancer symptoms can vary from person to person, and in its earliest stages, breast cancer may cause no noticeable symptoms at all. The most common warning sign is a new lump or mass in the breast or underarm, armpit, which may feel hot, painless, and have irregular urges, though some lumps can be tender or rounded. Other possible symptoms include swelling of all or part of the breast, even without a distinct lump, skin irritation, or dimpling that resembles the texture of an orange peel, breast or nipple pain that doesn't go away, nipple retraction, turning inward, redness, skinness, or thickening of the nipple or breast skin, and any unusual discharge from the nipple, especially if it's clear, bloody, or happens without squeezing. It's important to remember that most breast changes are not cancer. They can be caused by cysts, infections, or hormonal shifts. But if you notice any of these symptoms, it's best to see a doctor promptly. Regular self-awareness and routine mammograms help spot changes early when treatment is most effective. Breast cancer stages describe how far the cancer has spread and help guide treatment decisions, ranging from stage 0 to stage 4. See stage 0, also called ductal carcinoma in situ, or DCIS, means abnormal cells are found only in the milk ducts and haven't invaded nearby breast tissue. It's considered non-invasive and highly treatable. Stage 1 indicates a small invasive tumor up to 2 centimeters that may have spread only slightly into nearby lymph nodes, if at all. Stage 2 covers large tumors, 2 to 5 centimeters, or smaller tumors that have spread to a few lymph nodes under the arm. Stage 3 is often called locally advanced, The cancer is larger, has spread more extensively to surrounding lymph nodes or tissues, like the chest wall or skin, but not to distant organs. Stage 4, also known as metastatic breast cancer, means the cancer has spread beyond the breast and nearby lymph nodes to other parts of the body, such as the bones, liver, lungs, or brain. In general, lower stages have a better prognosis and are easier to treat, while stage 4 is not curable, but can often be managed as a chronic condition with ongoing treatments to control growth and maintain quality of life. Breast cancer diagnosis typically begins with a screening or after noticing a concerning symptom, followed by several tests to confirm whether cancer is present and determine its type and extent. A clinical breast exam by a doctor checks for lumps or abnormalities, but imaging tests are key. A mammogram is the most common screening tool, while ultrasound or MRI may provide additional detail, especially for dense breast tissue or suspicious findings. If an area looks concerning, a biopsy is performed. This involves removing a small sample of breast tissue or cells with a needle, sometimes guided by imaging. So a pathologist can examine it under a microscope to confirm if cancer cells exist. If cancer is found, additional tests on the biopsy sample, such as hormone receptor and HER2 testing, help identify the cancer-specific characteristics. To determine the stage and whether the cancer has spread, doctors may order blood tests, a chest X-ray, a CT scan, a bone scan, or a positron emission tomography scan. Together, these steps allow the medical team to make an accurate diagnosis and plan the most effective treatment. Breast cancer treatment is highly individualized and depends on the type, stage, molecular characteristics such as hormone receptor and HER2 status, and the patient's overall health and preferences. The main treatment options include local therapies, which target the tumor directly, and systemic therapies, which travel through the bloodstream to reach cancer cells anywhere in the body. Surgery is often the first step and may involve a lumpectomy, removing only the tumor and a small margin of surrounding tissue, or mastectomy, removing the whole breast, sometimes with removal of nearby lymph nodes. Radiation therapy uses high-energy beams to kill any remaining cancer cells in the breast or chest area, typically after lumpectomy or mastectomy. Systemic treatments include chemotherapy, drugs that kill fast-growing cells, often given before surgery to shrink tumors or after to reduce recurrence risk. Hormone therapy for hormone receptor positive cancers, blocking estrogen or progesterone that fuel growth. Targeted therapy, drugs like trastuzumab for HER2 positive cancers that attack specific cancer cell features, and immunotherapy, helping the immune system recognize and fight cancer, especially for triple-negative breast cancer. Many patients receive a combination of these treatments over several months, and the plan is carefully tailored to balance effectiveness with quality of life, often involving a multidisciplinary team of oncologists, surgeons, and radiation specialists. Okay, how to prevent breast cancer? While there is no guaranteed way to prevent breast cancer entirely, you can significantly lower your risk by adopting healthy lifestyle habits and staying aware of your body. Eating more vegetables and fruits not only helps prevent cancer, but also lower risks of cardiovascular diseases, stroke, and chronic diseases. The daily intake of 300 to 500 grams of vegetables and 200 to 350 grams of fresh fruits are recommended. Mushrooms like shiitake mushroom, Agaricus bisporus, contains aromatase inhibitors, and aromatase is a vital catalyzing enzyme helping synthesize estrogen. Regular physical activity, such as brisk walking or exercising for at least 30 minutes a day, helps maintain a healthy weight, especially after menopause, when excess body fat can raise risk. Limiting alcohol intake, ideally no more than 1 drink per day, or avoiding it altogether. And avoiding tobacco products also make a meaningful difference. For those who give birth, breastfeeding for several months may offer protective benefits. If you have a family history or known genetic mutations like breast cancer gene 1 or breast cancer gene 2, talk to your doctor about additional options such as earlier and more frequent screenings, risk-reducing medications, or even preventive surgery in very high-risk cases. Most importantly, routine mammograms and clinical breast exams don't prevent cancer, but they help catch it early when it's most treatable. No single action guarantees prevention, but combining these steps can reduce your overall risk and support long-term breast health. Greenwood products help too. Number 1, breast care tea. Breast care capsule removes the blood stasis that is believed to be the risk factor of breast lumps, according to traditional Chinese theories. It also improves the qi and blood circulation, contributing to lowered risk of breast lumps. Number 2, soy power capsule. Isoflavones are plant-based compounds extracted from soy. As one of the phytoestrogens, soy isoflavones may help with breast cancer by acting as weak selective estrogen modulators. They preferentially bind to the estrogen receptor beta, which is thought to have anti-proliferative effects and can oppose the action of stronger cancer-promoting estrogens that act through estrogen receptor alpha. Large population studies have shown that post-diagnosis consumption of soy foods is associated with a roughly 25% reduced risk of breast cancer recurrence, particularly in postmenopausal women, and is not harmful even for those on hormone therapies like tamoxifen. Number 3, pine pollen tea. Estrogen dominance is considered one of the factors of breast lumps. The phytoestrogens in pine pollen may help moderate estrogen levels by binding to estrogen receptors, potentially reducing the intensity of estrogen's effects in cases of estrogen dominance. While pine pollen contains phytoestrogens, it also contains compounds that may help support the production of other hormones, like progesterone. By balancing estrogen and progesterone, pine pollen could theoretically help correct the hormonal imbalance that underlies estrogen dominance. Number 4, Ganoderma Plus capsule. It may have adjuvant benefits in cancer care. The active compounds in Ganoderma, such as polysaccharides, tryptophanes, peptides, and glycoproteins, are thought to have various effects that could potentially assist in fighting cancer or improving the quality of life for cancer patients. Ganoderic acid in Ganoderma may slow the growth of tumors in certain cancers through inhibiting angiogenesis. Tumors grow their own blood vessels to supply oxygen and nutrient, and reduces metastasis, the ability of cancer cells to migrate from their original location to other parts of the body. Okay, that's all about these topics. Thank you for listening. Thank you, Mr. Fred.
Thank you very much, Madam Linda, for that wonderful presentation on these two very important and critical issues that affect most women, a lot of women, but men are not left out. In rare cases, we have seen men who have been affected by these two, and the information you've shared, I think, will go a long way in helping people to be able to know how to handle these situations when they arise, and also to be able to detect them early enough, because, like I said at the beginning, early detection determines a lot how later treatment will be effective. So thank you very much. Thanks to every one of you who attended this session. We hope that, like the rest of us, you have learned a few things that you didn't initially know, or you didn't know before. We encourage you to there is so much information. Don't just limit yourself to what you've had. This should be to just jog your mind, open your mind. But reading will also help you to learn more, because as time goes, also new information comes up, new ways of detection and management come up. So continue reading, continue attending these sessions where we try our best to bring to you wonderful and insightful topics about health that can help you to to change your life and improve your well-being. So with that, we have come to the end of tonight's training. I can see Madam Happy has raised her hand. Madam Happy, please unmute, make your comment or question so that we can.
Thank you very much, Fred, for giving me a chance to say something. And Madam Linda, thank you so much. My eyes have been a bit more opened today. So now the two things that came into my mind as you talked, because I think a week or two ago, I can't remember, there was also a training on some breast stuff anyway, women. And it's summer now here where I live, so we go swimming at the beach. And today you talked about, for me, all my life, I've thought breast cancer is women only. So now you are saying it could affect men too. So I noticed that yesterday I was at the beach. I'm looking. I'm actually now actively looking. There are so many men. Once upon a time, the men used to just have a nipple, two nipples there. But now there are so men with breasts. They actually have, you look, it's like, oh my God, those are breasts of a 16-year-old or something like that. That maybe it's time we started checking with our partners, our husbands, our fathers, our brothers, check if they have breasts, also to talk about it and say, you know what, maybe you should lose some weight, maybe because it could be you have the possibility of also having this disease. I never thought about that. But the second thing you talked about in the first presentation, anger. I'm a therapist, anger. Now it's saying anger can bring on even these breast issues, cancers, anger. We women have a lot of anger issues, I think, in our homes. But you said we should have a better mood, a better disposition to try and not let that anger cause breast cancer in us. And this is not a theory. I know a friend in Germany, she's dead now, but there was something that upset her in her marriage. She was a Christian, and she thought, okay, you know what, I won't talk about it. I'll just forgive the situation. But the anger kept on eating inside her. She went to the hospital, and the hospital actually told her, are you having is there something you're angry about, something? And she said, I don't know. But she kept on harboring it. So they treated the one breast. She never addressed the issue. Then the second breast started, and she ended up having both breasts taken out. And only when she had that did she have counseling with the person who annoyed her. Had, once a month, she'd just say what she wanted, but it was already too late. So ladies out there, if you're angry about something, I'm not saying go and now quarrel with everybody. That's not what I'm saying. But acknowledge it to yourself and say, I am angry about this. And then, pray and just get your cheerful disposition back. It's not worth it dying because you're angry about something else that somebody did. So thank you for reminding me again that our moods, our disposition play a big role. So let's not be angry. Life is too short. Thank you so much, Fred. Thank you, Linda, again, for opening our eyes to simple things that we can change.
Thank you,
Madam Happy. Madam Happy, every time I see that yellow hand, I really am happy because most of the time you raise your hand up, and I just want you to know that we really appreciate what you do for these meetings, because the practical the testimonies and the practical examples that you normally give. Make the training to feel very real. Yeah, and I know a lot of people are learning a lot, and when they're able to connect the training with the actual events and happenings, it makes it stick even better. So we appreciate you and we appreciate your contributions to our trainings. Asante sana. We hope that we can always have you in these sessions.
No, I have to say thank you to you trainers. Honestly, my heart, you don't know how you have enriched my life in this 1 year. You don't know how much you have broadened my perspective. I'm not a doctor, but I swear very soon I'll just go to the second-hand store and get a white jacket. Honestly, I have learned so much in this 1 year. I've learned so much. Thank you, Linda. Thank you, Michelle. Thank you, all the trainers. And you, Fred, for being constantly there moderating. I appreciate it. And when I can come, I come not because I have to. It's because I want to. And I'm learning. And we are helping humanity. Each thing we learn here, if we can apply it in our lives, in the people around us, it doesn't matter where you live, look around you. Somebody is sick somewhere, and apply these trainings that we are learning. Guess what? You'll sell a product. Yeah, and you'll be soon honorary chairman. That's what you need. But you need to learn. And that's why I appreciate even my team members who are on the program, who, when they can come, they also join in these. I'm very, very grateful for everything you guys do. They do. Thank you so much.
Thank you very much.